Good afternoon, and welcome to What to Do When Hacktivists Target Your Health System, a complimentary webinar from healthsystemCIO.com, sponsored by Proofpoint. Just some housekeeping before we get started. I'm the moderator. My name is Anthony Guerra. I'm the editor-in-chief of healthsystemCIO.com. To ask a question, which is something we encourage, go ahead and type it into the lower right-hand corner of your screen in the Q&A box. Send them in at any time, and leave the default set to all panelists. We'll be looking at those and posing them later in the program, but you can go ahead and send them in at any time. You can download the deck. You'll see the URL in front of you. I will send it out in the chat box, and there's also a shortened URL at the bottom of all the slides, so we encourage you to go ahead and grab the deck. And we will have an archive available of today's event, usually within 2 business days. You'll get an email when it's ready, and a separate registration is required. Just to see how we're going to spend our time today, we're going to go about 45 minutes. First, we're going to hear from Dr. Daniel Nigrin, CIO at Boston Children's Hospital. Then we're going to hear from our sponsor, represented by Patrick Wheeler, Director of Product Marketing with Proofpoint. And then we're going to have our Q&A with Daniel. So without further delay, I'm going to turn it over to Dr. Daniel Nigrin. Daniel, thank you so much for joining us.
Thanks, Anthony, for having me. So I'd like to spend the next half an hour or so talking about a really interesting, to say the least, event that occurred to us here at Boston Children's this past spring, but one that I think highlights a lot of important things that all of us in the healthcare industry need to pay close attention to moving forward. So I'm going to spend the time talking about this particular event and giving in some detail an accounting of what happened. We'll then move on to basically how we responded as an organization, what the steps we took were to defend against this attack, and then highlight some of the lessons learned that I discussed before. And further, is this something that was an isolated event, or is this something that we need to be thinking about more broadly? Go ahead, Anthony. Next slide, please. So everything began on March the 20th of this year when we at Boston Children's got a notification from an external cyber intelligence group about some really ominous postings that found their way to the online site Pastebin, as well as some Twitter posts that were purportedly coming from the hacking group Anonymous, and that essentially threatened an attack against our institution. This was all the result of a very highly publicized child custody case that had made the news in multiple outlets, both print and online and on television. And basically, Anonymous had decided that these things were not to their liking, and that our institution therefore needed to be targeted. So for those of you not aware, Anonymous is a well-known hacktivist organization. In the past, they've gone after some pretty high-profile organizations, including countries around the world, including large corporate entities, Sony, etc. They've even gone after law enforcement organizations like the FBI. So in the initial posting that we got notified of, they started by outlining some information about people on our staff here at the hospital, as well as the presiding judge who was overseeing the patient case. I learned a new term as part of this. This is something that's called doxing of individuals, presumably refers to the fact that documents or information about these people are posted online. So in our case, what they did was to post both work and home phone numbers of individuals, home addresses, email addresses, basically their private credentials. In addition, what they did was post what I would call details of our Boston Children's external websites. And when I use details, I put it in quotes because many individuals out there with a modicum of IT expertise would be able to have determined some of the information that they presented. Nonetheless, it was meant to be a message to us that we ought to pay attention. So next slide, which in fact is a video. Go ahead and run that, Anthony.
Greetings, fellow citizens, we're anonymous. It has come to our attention that a 15-year-old girl has been held against her will by the state of Massachusetts for over 1 year. Boston Children's Hospital believes that it all is merely in her head, and as a result she has been detained in addition to being tortured physically and mentally by this corrupted system for nothing more than being sick. Anonymous and the American people will not tolerate this abuse of our children and will retaliate using whatever means necessary in order to protect our fellow citizens from this abusive and manipulative behavior.
So, clearly a somewhat ominous video. I should mention that this YouTube link was posted in the original sort of manifesto that appeared that we were pointed to. So we had some decisions to make at this point. First of all, was this something that we needed to pay attention? Was this truly the famed anonymous hacking group that we had heard about before? And were they really coming after us as a hospital and as a children's hospital, no less? The skeptics among us said, well, gosh, it wasn't really hard to get a lot of the details that they posted, including the various credentials about the individuals. It's certainly not hard to post a video to YouTube. And even the website information that they got, again, as I mentioned, it wasn't really that sophisticated a set of IT information that they posted, and really someone without too much expertise could have done it. So part of us wanted to just say, no, this is just someone trying to get our attention, but they don't really have the ability to impact us. So we were faced with the question, should we just discount this? But our response, and I can think about this now in retrospect, was the right one, was no, we absolutely didn't discount it. And in fact, we took it extremely seriously as an organization, to the degree that we convened the hospital's incident response team. And this is not just the IT incident response team. This is the whole organization's team that mobilizes during natural disasters and other kinds of emergencies. And we talked about basically contingency plans that might need to be put into place should this turn out to be a true threat and one that we would have to deal with. We especially focused on the need to, quote, go dark, which is what we were using as the term to describe essentially cutting ourselves off from the Internet. We knew that in the past, Anonymous had targeted organizations, at least initially, with massive denial of service attacks. And if that were the case in our instance, that we could potentially lose both inbound and outbound Internet access. So we needed to think about that possibility and come up with plans to deal with that if so. We sent out a message to our entire organization, an email message emphasizing the vigilance, that there was a potentially credible threat made against us, and emphasize things that in the past we had always talked about with our staff, but that we reiterated around following email security best practices and so on. And then finally, in addition, we contacted state, city, and federal authorities about this threat. I will say as an aside that at this point, you know, especially considering the federal authorities, you know, what their response to us at that point was, well, this is, you know, potentially a threat, yes, but nothing has really occurred yet. So just keep your eye on it and let us know if anything else comes up. So really, not a lot of direct advice from those groups. So about 3 weeks later is when things really started to become interesting. We started to detect, our network engineers started to detect a low-volume distributed denial of service attack against our primary external website. This was not a large denial of service attack, and it was one that we were able to mitigate, frankly, with some network changes on our end. But what happened next was much like a cat and mouse game. We would address the attack with some technical changes to our network configuration, and they would change their tactic at that point to either change the approach of the denial of service attack and or to increase the volume with which they were hitting us. And that persisted for about 1 week. Now, I need to set the environment appropriately here with regard to contextual events. About 1 week later after this started was Easter weekend, and in Boston, this was also the anniversary of the Boston Marathon bombing event. So you had a city that was already on edge, I'll say. You know, clearly a concern about copycat kinds of attacks and security up in many instances. And the hospitals in particular were very, very focused on being in a state of preparedness. So this was not something that we needed, just speaking very frankly, on that weekend. The other thing that I'll mention is that it was a long holiday weekend. So the Monday, it was a vacation day in Boston because that's Patriots Day, and traditionally that's a day off in the city. So what we detected starting that Saturday was a massive uptick in the denial of service attack, and this was far greater than what we had experienced to date. And it was to the point that our internal network changes that had been able to accommodate the inbound attack were no longer able to do so. And we had to engage a third-party vendor to assist us in being able to filter off that malicious traffic. This is a graphic that nicely shows the volume, overall volume of the traffic. Let me just describe a bit of what's happening here. The little blue hump just above April 11th, that represents our normal inbound external website traffic that we would see on a normal weekday. And April 12th and 13th are weekends, which normally reflect the decrease in volume coming in. So really just a trickle there. What you then see, though, is starting on April 14th and throughout the next 5 or 6 days is the lower level denial of service attack. And you can see our routine traffic superimposed on top, those extra little humps. But then on April 19th is when they really hit us with that massive increase. And it was at that point where we really started to feel the effects and where we had to engage that third-party vendor to filter off the malicious traffic. And it's a good thing we did, because as you can see, the red represents the filtered traffic by our third-party vendor. And in the week that followed, that week of April 22nd and further, the volume that they hit us with increased even further, to the point where it was almost a 40-fold increase on our usual inbound web traffic at that point. Suffice to say that if we had not engaged with the external vendor, we would have been paralyzed at that point, and our worst fears would have been realized. Now, we became quite adept during all of this at monitoring Twitter feeds, because this was this was their way of sort of communicating perhaps amongst themselves, but also giving messages outbound to us. This is the Twitter feed of an individual who went by the handle Anon Mercurial, and you can read all of the various Twitter posts there as well, but I focus you on just some of them which highlight, for example, the Mass Medical Society up top, an organization called Wayside Youth in the middle, which is where the child who is no longer a patient at our organization, I should point out, which is where she was being cared for. And then finally, and perhaps most ominous to us, was the tweet that's towards the bottom there in red. Doxes of your staff are next, HIPAA breach thereafter, test us. So clearly this got our attention. We recognized that this may mean that they were planning more than just a denial of service attack, and that they were going to try and breach us and get to sensitive data. And as expected, that's exactly what they did. Our network engineers started to detect many attacks on our exposed web ports and websites. So essentially any open port that we had on our external network was being attacked, and attempts were being made to enter our network through those avenues. So we took the proactive step of essentially shutting down all of our externally facing websites, including research sites, philanthropy sites, our provider portals, patient portals, everything basically. Any FTP site, any open web port was shut down. And this was proactive, again, to prevent them from having an easy entry point into our organization. On top of that, we detected a huge volume of malware-laden emails that were sent to us in batch form. And when we detected this, basically within the next half hour or so, we again took a proactive step to shut down our entire email system. And we did this so that we were able to first ensure that our filtering solutions that we had in place detected all of these inbound malware-laden emails to be sure that none of them made it through to our end users, but also so that we were able to communicate to our entire organization about the imminent threat that this posed, and to reiterate the messages we had sent already around not opening suspicious emails, clicking suspicious links, and so on. Now, this was a challenge, as you can imagine, in an organization that's 15,000 strong. Communicating to that entire organization without email is no small task. And so, as I'll mention a little bit later, this was one of our lessons learned around having good plans in place around how one does mass communication to an organization without the benefit of email. Now, one thing that I should point out is that while we were in the midst of this, clearly we re-engaged with all of those authorities that I mentioned before, the local, state, and federal authorities. And in particular, we were advised by the federal authorities about the approach of not being very public about this event. Clearly, we had messaged our entire organization about it, but as far as going to the media and letting the outside world know what was going on, they strongly advised against it, simply because in their past experience with Anonymous, this organization tends to feed off of that publicity and media hype. And so it was their advice to us to just sort of keep our lips sealed. Well, Friday morning when I came to work, I was therefore somewhat surprised to find this as the front page of the Boston Globe. I suppose when you email your entire organization letting them know about this imminent threat and the attack, it's pretty much inevitable that that's going to leak out to the outside world, and in fact that's what happened. And the Globe did their investigative reporting, and really with no information from us, we're able to piece together the story quite well. And so this was the front page of the Globe that day. And so I was nervous, speaking frankly, at this point, because this was exactly what we had been advised to try and avoid at all costs, and yet here it was right on the front page. What happened next, though, is an interesting twist, and in fact represents the beginning of the end of the attack. There was another Twitter post made that morning, or later that afternoon perhaps, by a different anonymous character on Twitter. This one was just called Anonymous at Your Anon News. And you can read the content of the Twitter post right there. To all of the Anons attacking the Children's Hospital in the name of Anonymous, it's a hospital. Stop it. So clearly, despite the fact that Anonymous is always perceived as being a non-hierarchical group of individuals without much structure, here was an individual who was sort of giving his or her 2 cents about what was going on and perhaps advising others in the group about what they should be doing or should not be doing. Now, I've highlighted some interesting numbers on this individual's Twitter feed. Note the number of followers that he or she's got, 1.24 million. If we now go back to our other friend, Non-Mercurial, you can see that they had a total of 6 followers. So clearly, in the anonymous hierarchy, I would put my my weight behind the previous Twitter poster and not a Non-Mercurial. So nonetheless, within the next I'd say 24 hours after that Twitter posting, all of a sudden the denial of service attacks stopped, as well as all of the other attacks that had been in place, including the emails and the attacks on our external firewall. The DDoS attack didn't completely go to zero. It was just simply at a much lower level, and our guess is simply that some of the bots that they had commandeered to be the source of the denial of service attack just didn't get the message to stop attacking us, and they continued for a while longer. We then took a very in-depth look at every one of our externally facing web presences, including obviously our primary web portal, but also things like our patient and provider portals, philanthropy sites, research sites, etc. And despite the fact that we had done penetration testing on all of those in the past, we redid all of that pen testing, again using outside vendors with extensive experience in this type of thing to validate that those sites were secure. And it's only gradually over the period of the next several weeks that we brought those back online. And then we took a deep breath and basically told ourselves to be thankful that we made it through that essentially unscathed. Now, my parents, when I was growing up, always taught me that of all bad things, good things eventually come, and I think this was no exception to that. First, somewhat jokingly, I got a good New England Journal of Medicine paper out of it, so that was one positive. But jokes aside, we did learn many important lessons as part of this. The first, and somewhat obviously, is that denial of service countermeasures and security is absolutely critical. I think in the past, healthcare probably didn't think about DDoS attacks as being something that we would need to or prevent against and be the subject of. But clearly this episode suggests differently. Now, whether or not it's going to be anonymous attacking an organization or some other, less high-profile group, you can envision how an individual who was disgruntled with your organization for whatever reason could relatively easily, with tools available on the internet, could get the tools necessary to be able to conduct an attack like this on your organization. As I mentioned before, one of the things that we focused on during our planning ahead of time was in knowing what systems that we had in place or features within those systems were dependent on internet access to work appropriately. In the past, clearly, we had always had plans in place to account for full loss of network service within our organization. But we had not really thought about this hybrid state in which we had an internal network that was still functioning, but one which no longer was able to get to the outside world. And this was important because being able to convey to our clinicians, for example, the subtlety of being able to use our EHR system, which was still up and running because we were locally hosted, but not being able to use some of the features within that system because of the lack of internet access, that was challenging. So in our instance, for example, all of our prescription routing, our electronic prescription routing, or being able to access, dispensed medication history through our pharmacy network, all of that was unavailable because we had lost internet connectivity briefly. So that was challenging for us, and it was representative of the bigger challenge about knowing what systems we had in place that did depend on the internet for full functionality. As I mentioned before, this issue of communicating inside of our organization without email was an important lesson learned, and one which we're going to have much more robust contingency plans moving forward. In our case, we were very fortunate because we had recently implemented a secure texting solution within our organization, which we were able to use heavily in the setting where we had shut down our email system. We also used SneakerNet. We were certainly not above that, and we were very effective in getting the word out through just people walking the halls of our inpatient and ambulatory spaces. The next bullet represents an issue which I know many of us in the sort of leadership of IT organizations within our institutions have had to deal with, and that's this balancing act around pushing through security initiatives which we know are going to help us be more secure, but which also potentially disrupt our routine operations. What this event helped us to do was to essentially focus on the burning platform that was in front of us and allowed us to push through those security initiatives in rapid fashion. And I think if you want to use my experience as something to use internally at your own organizations to help you push some of these things through, I'd be happy if you did so. In our case, one example was using web proxies that we previously had hemmed and hawed about implementing, and yet this was clearly an indication that it was time to push that through. Somewhat amusing next bullet is a piece of information that we were informed about through our federal authorities that were helping us. They recounted to us an episode in which Anonymous had infiltrated the teleconference calls that an organization had been using to discuss how they would deal with the attack that Anonymous was reporting on them at the time. And essentially what happened was Anonymous had penetrated their email system and was getting all of the Outlook notifications for these teleconferences, which included the passcode for all of those teleconferences as well. So suffice it to say that Anonymous was listening in on all of their planning meetings that were being held by telephone around how they would deal with the situation. And quite comically, Anonymous posted within minutes of the conclusion of one of those meetings the full transcript, audio transcript of the meeting online onto YouTube. So this was an example highlighted for us around the fact that we need to secure our teleconferences and send those passcodes out to folks using mechanisms other than email. And then the last one is a very interesting phenomenon. clearly the organization was tuned into what was going on, especially when it hit the front page of the Globe for sure. And we were getting reports from all corners of the organization about things that individuals thought might be suspicious. If you see something, say something, right? Well, that yielded an incredible amount of signal as well as noise. And one example was the fact that some individuals, just a handful, noticed that they had gotten a phone call on their personal cell phones from a number that was listed as 0000000, and it was an automated recording telling folks that their personal bank accounts had been compromised, and to press 1 to cancel those accounts and to investigate further. So clearly this was some kind of scam. Whether or not it was related in some way to the anonymous attack, I don't think so. I don't know that for sure. But I think it was just an instance of true but unrelated events occurring. And so I add this bullet simply to highlight one of the challenges we had during all of this, which was the number of reports that we had to our command center of potential issues and how to be able to triage and deal with them effectively. But I think the most important thing, and I put this in red, is that as an industry, security is something that we've needed to make front and center for a long time. And for sure, with all of the breaches and attacks on data that we've had recently, I think we're starting to understand that more clearly now. But what this represents is yet another attack that I don't think we've been well tuned into in the past, and that's an attack that's meant to disrupt first and foremost. Clearly, although the postings indicated that they were anxious to potentially get in and get to some data as well, the primary mission, if I could guess, was to disrupt us and to draw attention to us. But clearly that disruption could have had dramatic impact to our routine operations here at the hospital. So whether it's anonymous or a disgruntled employee or any other person sort of being behind an attack like this, I do think that we need to plan more for this kind of disruption and attack in the future. And it's not something that we can ignore anymore. Healthcare is certainly not above this in any way. So with that, Anthony, I'll hand it back to you.
Very good. Well, thank you so much for that great presentation, and I look forward to some Q&A. But first, we're going to hear from our sponsor, represented by Patrick Wielder, Director of Product Marketing with Proofpoint. Patrick?
Great. Thank you, Anthony, and thank you, Daniel, for a really interesting and compelling story. And I think, what you hit on, I think one of the key takeaways from that is, not only the threat that targeted attacks pose from anonymous, but the fact that there are a lot of actors out there who can target an organization. Disgruntled employees are just one, anonymous, but also for whether it's cyber criminals or state actors. And so the fact is that in our research at Proofpoint, we've really found that every organization is under attack, and just some attacks are more targeted than others, and some are higher profile than others. A lot of times, I think the bigger challenge is that you may, unlike with anonymous, you may not actually know that the attack is coming. And we find that some of the main vectors for targeted attacks in organizations when they're going after you is our spear phishing, web hacks, as you saw, and DDoS attacks are very common. And I think your point about how an individual with the tools available on the internet can very easily attack your organization. I think that's one thing that's really, we see all the time, not just, in healthcare, but really for organizations across verticals. You don't need a lot of expertise to actually conduct a, highly targeted attack on an individual or a more general phishing campaign against specific organizations or against specific verticals. And we find is that, phishing remains really the primary attack vector. And especially for highly targeted attacks, those spear phishing attacks that can lead to some of the worst breaches. And most organizations, as you did, respond with user education, letting users know to be aware of these attacks. And that certainly, I think the response from the staff at the hospital at Boston Children's was really exemplary of how folks really kind of understood the importance of watching out for the email. But one thing we find is that user education really ultimately has limits because our own research has found that in every org, somebody will click. And so the challenge really is then how do you mitigate the impact of this? Because phishing emails, they can be very convincing. We recently saw a phishing email that was targeted at a limited number of organizations, and it was a very technical email that really bore very few of the traits of a phishing email. It was actually about the Poodle exploit with the SSL and TLS SSL vulnerability. It included an Excel spreadsheet and instructions not to forward on to other users or to other people in the organization. So in many ways, it really was the opposite of what you would expect from a phishing email. And so it looked very convincing. But in fact, it was because of that credibility, because it did not look like a phishing email, and of course, it made it very credible. And so we did actually, in fact, see cases where users really attempted to open it, to execute it. And so the challenge is that when users are creating these targeted phishing emails, we find that target attacks. We find that, as you mentioned, doxing staff and employees. Doxing, of course, gives an attacker all the info they need to create a highly targeted phishing email. Of course, if this information is available to public actors, very well-known, highly visible attackers like Anonymous, it's also generally available to. It can be found by others as well. It's very easy to craft these kinds of targeted attacks on organizations. And one of the things we find is that even the less highly crafted emails can actually be very effective. Our research has found that the three most effective phishing templates are social media, account warnings, and invoice or shipping receipts. And social invites are actually 2 times more effective than any others, and LinkedIn invites, interestingly, are actually 4 times more effective. So that when you are looking out for when you're warning your users about these targeted attacks, to be wary of unexpected emails or suspicious emails and suspicious attachments. It's important to remember that attackers are also very good at using, essentially building social engineering into their phishing campaigns so that ultimately they have a higher probability of getting a user to click. And on average, we find that in most organizations, 1 in 10 recipients click on malicious links, and that 20% of these clicks actually occur off the network. And so what's actually really interesting to me is that a lot of times, actually, these clicks are even on very old emails. We found 1 in 15 clicks actually occur on emails that were received as much as a month previous. So ultimately, the challenge is that, as one of our security researchers put it, the best technology can't protect you against the user with a mouse. And so ultimately, it's important to really be able to not only identify and stop these threats as they're coming in, but also have the ability to detect when users click, because ultimately your users are also a critical part of your overall capability. And so detecting and stopping today's most advanced techniques is essential, but because emails are really the most likely to get through, you also need a defense that allows you to account for the human factor. And so ultimately, Proofpoint delivers this capability as part of an integrated next-generation defense solution that combines the ability to block known threats, detect advanced and targeted threats, and enable organizations to carry out a rapid response to threats that have penetrated the organization. And who is Proofpoint? So I think the most important thing we can tell you is about our customers. Proofpoint protects 40% of the Fortune 100 across a complete range of industries. We've received awards in email security and security from a range of sources. And we're recognized by industry experts as the leader in email security. So visit proofpoint.com to learn more. And with that, I'm going to turn it back to Anthony and Daniel for Q&A.
Thank you so much, Patrick. Appreciate your support of the event. I think it's an important one to get in front of people. So, Daniel, we have a few minutes for Q&A. And one question that has come in from two separate folks at provider organizations is asking you about your relationship with the third-party vendor that ultimately assisted you with the attack. And I think people are very curious as to whether they should run out and establish a relationship, get some kind of agreement in place, or at least understand the field of their options better, or is this something that you engage someone sort of as the attack was coming in front of you? What are your thoughts and best advice around that?
Well, thanks, Anthony. In this instance, we were fortunate in how this all unfolded because of that 3-week lag between when we got original wind of the threat and when it actually started, we did exactly that. We started to have discussions with the various vendors that we knew were out there, and although we did not have a formal agreement in place, we at least had talked through what would be involved with the vendors. And essentially, we had the phone number ready to make the phone call, which is in fact what we did in earnest when we saw that volume increase. And we were fortunate in that, I think within a span of about 12 or 18 hours, we were able to get the solution implemented and functioning without too much trouble. But I don't think we would have been nearly that quick had we not had those conversations with the third parties in advance. So yeah, I'd say at a minimum that would be what I would advise folks to do. Whether or not you engage with those vendors and sign contractual agreements, I think that'll be up to each individual organization, but I will tell you that we now do have in place in an ongoing way protection against DDoS attacks.
Patrick, I would like to bring in, because it's relevant for this question, what can you tell us about the kind of arrangements that health systems could make with organizations like yours to make sure that they have services when they need them and that they don't make a call and I don't know if this would ever be the case, but oh, sorry, we don't have the resources at the moment. 3 of our other customers are getting attacked. I don't know, but what are your thoughts around what health systems should be doing here?
No, that's a great question. I think what they did, the same kind of engagement with their vendors would be what that Dennis said they had with their vendors would be what I would recommend. Proofpoint has, for example, a highly trained and dedicated technical support staff and account teams who focus on making sure our customers have what they need, especially in these crisis moments. So engaging, for example, in this case, Proofpoint, letting us know, that you expect an attack, and there have been cases actually where we've sometimes heard even through, we've heard from customers that attacks have been impending, and we've actually been able to tell them that actually, sensors are detecting that there's stuff that we're blocking already. Once again, giving us a heads up that you're expecting some kind of activity that you need, for example, sometimes to potentially have additional capabilities available to handle increased loads, and also have the support staff kind of ready for emergency calls is really key. So I think just making sure you talk with your vendor about what you think is going to happen, coming up with that as part of your overall action plan. And I think Daniel's outline of that action plan they took, and the fact that he engaged not just their IT rapid incident response team, but the entire organizational incident response team, was really a great example of how to handle this kind of event.
Thank you. Okay, Daniel, a couple more minutes. Next question, how did you address your patient portal? Additionally, did you send a communication to patients and families during and after the attack?
We did not send a communication specifically out to them. Part of the problem was that we had no email at the time. What we did do is put a message actually, during the period where we had no internet connectivity during that brief 12 or 18 hours, basically they were just not able to get to the portal at all. After that, we put up a message, and this is This is when we were scanning all of our applications to be sure that they were immune from penetration. We put up a system down for maintenance and please come back at another time kind of message. I think we were a little bit helped here with the media that was focused on this. You know, word was clearly out in the general community around what was going on, and I think folks put two and two together. But it is one of the things that we're thinking about for the future, again, in how we do communication when we potentially have our usual communication channels disrupted and inclusive of patients and families. It's a tricky situation there, since primarily we use the portal itself and or email to get to those people.
There's one more question before we get going, Daniel. Do you have a CISO, and did you find that to be very helpful during an event like this?
We do have a CISO, and it was extremely fortunate that we did. I think he aged about 3 years in those few weeks. But he was absolutely critical, a leader behind the scenes in all of this, and was incredibly important both in communicating internally with the executives within our organization, but also in orchestrating the internal IT response and being sort of the point person, if you will, for organizing all of our internal activities.
Very good. Well, that is about all we had time for today. I want to thank Dr. Nigrin for joining us, and he's always a great guest, and we hope he'll join us again for another topic. I want to thank Proofpoint for sponsoring this event and making it possible, and all the participation and the presentation we received from Patrick Wheeler. You'll receive an email when our archive recording is ready, usually within 2 business days, as I mentioned, and you have to separate registration is required. Regarding Chime CIO credits, attending our events gets you 1 credit. So if you've asked us to communicate that to Chime, we will. If you are going to do it on your own, don't forget to go ahead and do it. Questions, comments, reach out to me, and you can go to our site to see our upcoming events and our last 12 months of archived events. So with that, I again want to thank Daniel and Patrick and our attendees, and everybody have a wonderful day. Thank you.
Pleasure. Thank you, everybody.